Mandibular nerve. Mandibular nerve is the largest of the three divisions of the trigeminal nerve. It is a mixed nerve that consists of both sensory and motor fibers. It is a nerve of the first pharyngeal arch. Hence, it supplies all the structures derived from the first pharyngeal arch, for example, the muscles of mastication. And it is associated with two ganglions, that is the otic and submandibular ganglion. Then about the formation and division of the mandibular nerve. The mandibular nerve is the largest of the three divisions of the trigeminal nerve. It begins in the middle cranial fossa as two roots. That is, it has a larger sensory root and a smaller motor root. The larger sensory root that arises from the lateral convex part of the trigeminal ganglion and immediately leaves the cranial cavity by passing through the foramen ovale to enter the infratemporal fossa. And it has a small motor root also. The motor root that arises from the pons and it lies deep to the trigeminal ganglion. And the sensory root, it also passes through the foramen ovale to join the sensory root just below the foramen ovale in the infratemporal fossa, thus forming the main trunk. That is, the motor root and the sensory root that leaves the cranial cavity through the foramen ovale, and both these roots that reaches the infratemporal fossa, where that roots unite to form the main trunk of the mandibular nerve. The mandibular nerve trunk is short, and after a short course, it divides into a small anterior and a large posterior division. Then about the relation of the main trunk, that is the main trunk that is medially related to the tensor velae palatini and the otic ganglion. And laterally it is related to the upper head of the lateral pterygoid muscle. And posteriorly that is related to middle meningeal artery. And anteriorly it is related to posterior border of the lateral pterygoid plate. Then about the branches from the main trunk. From the main trunk, there are two branches arises. That is a sensory branch, it is called as nervus spinosum, and a motor branch that is called as nerve to medial pterygoid. The nervus spinosus is also called as meningeal nerve. And this nervus spinosus that takes a recurrent course to enter the cranial cavity through a small foramen called as foramen spinosum along with the middle meningeal artery, and it supplies the dura mater of the middle cranial fossa. Then the second branch is called as nerve to medial pterygoid. This nerve that supplies the medial pterygoid, and it also gives a motor root to the otic ganglion, and without relay that supplies tensor velae palatini and tensor tympani muscle. So the nerve to medial pterygoid that supplies three muscles, that is a medial pterygoid muscle, then the tensor velae palatini and tensor tympani muscle. Then about the branches from the anterior division. The anterior division is mainly motor, and it gives branches to all the muscles of mastication except the medial pterygoid, which is supplied by the nerve to medial pterygoid from the main trunk. So the branches from the anterior division are the masseteric nerve, the deep temporal nerve, the nerve to lateral pterygoid, and the buccal nerve. And the masseteric nerve that supplies the masseter muscle. The deep temporal nerve that supplies the temporaris muscle. And the nerve to lateral pterygoid that supplies the lateral pterygoid muscle. All these are the muscles of mastication. Then it has one sensory branch also, which is called as buccal nerve. And this nerve that contains all the sensory fibers of the anterior division. And it emerges between the two heads of the lateral pterygoid and course downwards and forwards into the buccinator muscle and give branches to the skin of the cheek. Then about the branches from the posterior division. The posterior division is mainly sensory and gives the 3 branches. So the posterior division is mainly sensory and it gives 3 branches. The 3 branches are the auriculotemporal nerve, the lingual nerve and the inferior alveolar nerve. Then about the auriculotemporal nerve. This nerve arises by 2 roots, which after encircling the middle meningeal artery unite to form a single trunk. Then it runs backwards between the neck of the mandible and the sphenomandibular ligament. Behind the neck of the mandible, it runs upwards and ascends over the root of zygoma to enter the temple behind the superficial temporal vessel. Then about the distribution of this nerve. So it has 2 parts, an auricular part and the temporal part. The auricular part that supplies the skin of the tragus, the upper part of the inner, the external acoustic meatus and the tympanic membrane. And the temporal part that supplies the temple, the TMJ, and it also carries secretomotor and sensory fibers to the parotid gland. So this is about the auriculotemporal nerve. Then the second branch is called as the lingual nerve. So it is a smaller terminal branch of the posterior division of the mandibular nerve. It is sensory to the mucous membrane of the anterior two-thirds of the tongue except the valate papilla. And this branch that begins 1 cm below the skull, it runs between the tensor vela palatini and lateral pterygoid muscle. Then it lies between the lateral pterygoid and medial pterygoid. Then it is joined by the chorda tympanic nerve. It is a branch of the facial nerve. Then emerging at the lower border of the lateral pterygoid, it runs downwards and forwards between the ramus of the mandible and the medial pterygoid. Then it lies direct contact to the mandible behind the third molar teeth. Then it runs over the hyoglossus, genioglossus and deep to the mylohyoid. That is, it runs superficial to the hyoglossus and genioglossus and deep to the mylohyoid. Then it winds down the submandibular duct and divides into its terminal branches. Then about the third branch, that is the inferior alveolar nerve. It is the larger terminal branch of the posterior division of the mandibular nerve. It is a mixed nerve. It receives all the motor fibers of the trigeminal nerve. Then about the course of this inferior alveolar nerve, it emerges below the lower head of the lateral pterygoid and passes vertically downwards and forwards in the medial pterygoid. The nerve lies anterior to the inferior alveolar vessels between the sphenomandibular ligament and the ramus of the mandible. Then it enters the mandibular foramen along with the inferior alveolar artery and traverses the mandibular canal as far as the mental foramen, where it terminates by dividing into 2 branches, that is the mental branch and the incisive branch. And the mental branch that supplies the skin of the chin, skin and mucous membrane of the lower lip. And the incisive branch that supplies the labial aspect of the gums of the canine and the incisor teeth. So this is about the branches of the posterior division. Then about the clinical anatomy of the mandibular nerve. The motor part of the mandibular nerve is tested by asking the patient to clench the teeth. If one side masseter muscle is paralyzed, the jaw deviates to the paralyzed side while opening the mouth by the action of lateral pterygoid of the opposite side. The next is referred pain. It is a pain frequently referred from one branch of the mandibular nerve to the other. Thus, in patients suffering from the tongue cancer, the pain radiates to the ear and to the temporal fossa in the area of distribution of the auriculotemporal nerve. And this pain is relieved by dividing the lingual nerve below and behind the last molar teeth. The next applied anatomy is trigeminal neuralgia. So trigeminal neuralgia is an intractable pain along the distribution of the mandibular nerve. That is, during the extraction of the wisdom tooth, lingual nerve should be taken care. Its injury result the sensory loss in the anterior two-third of the tongue. That is, the anterior two-third of the tongue, the sensory supply is by the lingual nerve. Then during the extraction of the tooth, inferior alveolar nerve needs to be anesthetized, and the drug is given before the nerve enters the mandibular canal. The inferior alveolar nerve can be damaged, the fracture of the mandible also. So about the mandibular nerve, it is a mixed branch. It arises from the trigeminal ganglion, and it is one of the branch of the trigeminal nerve. That is, the trigeminal nerve has 3 branches: ophthalmic, maxillary and mandibular. So this is about the mandibular nerve. Thank you.